Hi, it's me again, Healthy by George, and today we're going to talk about the warning signs of stroke, and I'm going to explain what the B.E.F.A.S.T acronym really stands for if you want to be thinking about stroke, and even some things that are called TIA, transient ischemic, what is a TIA? Ischemic. I don't know what A stands for. I can't remember right now, but I'll think of it later. Maybe during the episode. So join me as we talk a little more about stroke, and I share with you what happened to me in the ER. Welcome to Healthy by George. I want you to know that this is for informational purposes only, and it should not be considered as medical advice, nor does it have anything related to my employer. So it's always best for you to check with your own medical provider before you do anything that I recommend or for any medical treatments. So please join me, hit that subscribe button, and turn on notifications so you never miss an episode. So, welcome to Healthy by George. My name is Mary Catherine George, and everyone calls me MC. And today, I really want to share with you in depth what happened to me, which made me end up in the emergency room. So, often we will have strange symptoms that we really can't explain. And for me, it was a feeling of tingling and numbness in my left side of my face that showed up very suddenly. And so I can't tell you how, nerve-wracking it is because I have a family history of heart attacks and stroke. And, one of the biggest probably risk factors is being overweight. So I'm overweight, and I also have some blood pressure. It's not really elevated, but it comes and goes. Another hypertension. I'm on it. It's very well controlled. I monitor it. But those are still risk factors that I have to consider. So I know very deeply what the acronym B.E.F.A.S.T means. It first of all means if you're having trouble with your balance, that's a problem. B stands for balance. If you have some type of eye issue, like blurring in one eye, loss of vision in one eye, or any kind of disturbance in one eye, that's a concern. The next thing is face, which is what was going on for me. Some kind of facial disturbance on one side. Most of the times when I've seen it happen, because it happened to my husband, he had a TIA. You see this fold right here in your face, it droops. All of a sudden, this fold will suddenly become droopy on one side, and you will also see a person slurring their words. There's suddenly this strange facial drooping. You will also see for the A, there'll be maybe some arm weakness. That's what the A stands for. It's face and then arm weakness. And the S stands for some kind of speech difficulty. Speech, like slurring your speech. With my husband, for him, when he had his TIA, he would just open his mouth and he couldn't form any words. It was very odd. So that means speech. And then the last one is T in fast. That means time is of the essence. And that's why when I went and spoke to the urgent nurse practice who was on the phone, I was able to get on telehealth right away. She said, even though I wasn't showing any signs of weakness or balance or slurring my words or loss of strength, I still should go to the ER and get worked up. Because you never know, as a woman, what are the signs truly for stroke? Because most of the studies have been done in men, not in women. In fact, with heart attacks, we see that women have a completely different profile for how they experience a heart attack. So, you just really can't be safe enough to ignore it. And I think that's what happens so often is people may be having some very small signs. Maybe there's some confusion or some kind of loss of their memory. And as you get older, this risk becomes even more prevalent. So when you think about stroke, if you have any of those risk factors, which I do, but I'm working on it, I'm mindful of it. I don't just ignore it. You still have to consider that you are at risk. And if you have any of those one-sided types of kind of symptoms, you should see it through. And so I did. I went to the ER. Thankfully, everything was normal. All my blood work, all my exams, my EKG, they did me the full workup. But I still don't really know why I'm having those strange tingling symptoms. So I did a further workup. I went and saw a neurologist just as a backup. And even if I still am having symptoms, I still may have a second, either a CAT scan of my brain or an MRI. And I'll see an allergist. And I will see an ear, nose, and throat doctor. Because this was so strange, like right here in the side of my face, and it's unclear as to why it happened. And if it is an early sign of something, I certainly want to get ahead of it and know how to prevent anything that could further make me disabled. So I don't want to be disabled. I don't think anybody does, right? And that's what a stroke does. It causes severe disability. I work in neurology, and so I understand very deeply how if you do have a stroke, it causes brain damage, because a stroke means that you've had a bleed or a blood vessel break in your brain due to either a blood clot that has lodged in a vessel in your brain, so the blood flow stops and it begins damaging that area, or you've had a blood vessel break. And these things can be really, really helped, not prevented, if you get to the emergency room quickly. That's why if you go in and have any type of a symptom that looks like a stroke, they call a stroke code and you are urgently seen, because they know that if the medicines they have available are going to help you, they need to be given you as soon as possible. So that's why I encourage you to really understand your body, understand your risk factors. In fact, let's think about what those risk factors are. I told you high blood pressure, which I have hypertension, but it's well controlled. But a lot of people go through their life and don't know their blood pressure. What's the problem with checking your blood pressure at home? There's tons of blood pressure machines that you can check, because this is the silent killer, is blood pressure that is not well controlled. So if you know someone's hypertensive in your family, you could be at risk of having hypertension. So don't keep from going to your primary care provider or getting that yearly health checkup, because those things need to be monitored. Also, too, if you have stressors in your life that cause you to have high stress, you should know what your blood pressure is, or if you feel your heart racing or you feel palpitations. Those are risk factors. Smoking. Are you smoking? That is a huge risk factor for narrowing of your arteries and causing damage. Smoking is truly one of the most difficult things for people to stop. And smoking is a big, big risk factor for stroke and heart attacks. Because again, it causes blood clots, it narrows arteries, it causes blood flow to be decreased, and that is a huge risk factor for a stroke and for a heart attack. If you're diabetic, where you don't have your well-controlled sugars, those are another things that are risk factors. So, don't wait till you have something happen. It's good to see your primary care provider, know what your cholesterol is, do some physical activity so that you are someone who is conscious and mindful of being a healthy person. The other thing that as you get older that I know is a big risk factor in my family and is atrial fibrillation. So what is that? Well, it's where there's this irregular heartbeat. And sometimes that can be caused by stress, where you feel like your heart is racing. So definitely check these things out with your doctor yearly. So we know as we get older, We know as we are trying our best to stay healthy, there are some things that are going to happen to us that we can't prevent, but we can do is keep them from making us disabled. Getting treatment or preventative things in place so that we can continue to have a happy, healthy, long life that is functional and meaningful. And that's all I want for everyone. I want it for myself. I know I'm on that journey, and I want it for others. So be kind to yourself. See your doctor regularly. Go to the ER or at least talk to someone in an acute care if you're having some kind of a strange symptom. That's really what's going to help you in the long run. Knowledge is power. Knowledge is power. And that's the whole purpose of why I'm here, to make health simpler, understandable, digestible, and less fearful. Because if we know what's happening with our body, we can do things. We can take control and make changes. So be well, my friend. And next time, we're going to talk a little bit about, I'm not sure, maybe we'll talk about insulin resistance, okay? I think that's a topic that's not easy to understand. Insulin resistance, metabolic disorders, and how can we help ourselves, okay? See you again. Bye-bye. So thank you so much for joining me at Healthy by George. I hope you found the information inspiring and that it encourages you on your wellness journey. Because remember, your body, your well-being are a most precious gift, and every tiny action taken daily can make a huge difference. I hope the information here is educational purposes and is not meant to replace your medical care. See your doctor and talk about what works for you. If you enjoyed today's content, don't forget to give it a thumbs up and subscribe to my channel. Your support means the world to me, and it helps me continuing creating content that inspires and empowers you to live your best life. Goodbye for now, and join me again at the next Healthy by George.